In this presentation of Best of ASCO 2019, my presentation is going to be focused on multiple myeloma. The advances that were presented in the May meeting up in Chicago of specifically on multiple myeloma that could potentially change practice in the next year or in the next upcoming years. I'm going to focus on two main topics. One of them, and it's actually totally in the opposite spectrum of the disease. One of them in a topic that is called smoldering multiple myeloma, and the other one is going to be in relapsed refractory multiple myeloma, meaning in patients that have progressed after one or more lines of therapy. The first one is smoldering multiple myeloma. Usually this disease, classically, we have been following these patients without treatment, but based on multiple big databases of big institutions such as Mayo Clinic, we know that there's a group of those patients of smoldering myeloma that are at higher risk for early progression to symptomatic multiple myeloma. When I mean symptomatic, it's patients that are presenting with fractures, renal failure, severe anemia, or very high calcium. Hence, there's an unmet need for those patients to find ways to delay that progression and eventually live more without full-blown, if I might say, multiple myeloma. So the first trial is a phase 3 randomized trial. It was presented by Dr. Sagar Loniel from Winship Cancer Center from Atlanta, where they randomized patients that with smoldering multiple myeloma between a medication that we use every single day in multiple myeloma that is called lenalidomide versus observation. So it was an ECOG clinical trial, so involved a lot of major centers in the US. And what it found is that patients treated with lenalidomide, smoldering multiple myeloma patients treating with lenalidomide, they have a better progression-free survival, meaning that they live longer without the disease and with need for treatment than patients on observation, that smoldering multiple myeloma patients on observation. But the most important part is that those patients, they took a longer amount of time in transforming from a smoldering multiple myeloma to a fully symptomatic multiple myeloma. Importantly, the patients that benefit the most were the ones that we call them high-risk smoldering multiple myeloma, meaning that they have a higher burden of plasma cells in the bone marrow, and they have more abnormal proteins, meaning a higher monoclonal protein in the blood and a higher free light chains. There's some caveats to there's some caveats to the trial, and we have to discuss when and we are going to use this type of intervention. As of now, it has not been approved by the FDA. So moving along, the second trial, moving along to the part of relapsed refractory multiple myeloma. There's one trial that I do believe might change the way we practice, the way we deliver some medications in the near future. It's called the COLOMBA trial. It was presented by Dr. Maria Mateos from Spain. And then it was a big global phase 3 randomized trial where they use a medication that we're very used to give to our patients that in the relapsed refractory setting of multiple myeloma, since it's been approved both in the relapsed refractory setting and the frontline setting, that is called Daratumumab. It's a monoclonal anti-CD38 antibody. The novelty of this trial is that they tested a new way to deliver the medication via a subcutaneous injection. Normally, we give IV Daratumumab, and it takes a long time for the infusion, especially in the first day. Why? Because we need to be careful of what we call infusion-related reactions. Hence, now there's a technology using a hyaluronidase molecule to deliver effectively this monoclonal antibody to the patient. So what Dr. Mateos and colleagues did is that they randomized more than 300 patients to single-agent intravenous Daratumumab versus single-agent subcutaneous Daratumumab. The primary endpoint was overall response rates and also to measure the pharmacokinetics of the medication to see that both medications have the same level on the blood after certain amounts of cycles. Both of the groups were, it was a randomized phase 3 trial, so all of the groups were very well balanced in terms of the baseline factors, and importantly, there were a lot of American patients here, so there were a lot of obese patients, and all of them were very well balanced according to the baseline factors. What we found is that these patients have the same overall response rate, being given IV Daratumumab versus subcutaneous Daratumumab. Also, that the concentration, the trough, meaning the level of the medication in the blood of the patients before starting the cycle 3 of either IV or subcutaneous Daratumumab, were the same. Also, on the secondary endpoints, the progression-free survival of those patients were the same. But strikingly, and that was, I don't know what it was, not the primary endpoint, but as a secondary endpoint, the infusion time of subcutaneous Daratumumab was only about 5 minutes versus around 6 to 7 hours for the patients in the first time. Also, the infusion-related reactions way lower with subcutaneous Daratumumab. So I do believe it might change our practice if they approve it, because it doesn't change the practice in terms of transforming the history, of course, of multiple myeloma, but it does affects the quality of life of the patients and the way we deliver this medication. So it might be something that we will be implementing in the short term. The next trial in relapsed refractory multiple myeloma is called the ICARIA trial. That is a phase 3 trial of a new molecule in the phase 3 arena of relapsed refractory multiple myeloma, of a new anti-CD38 monoclonal antibody that's called isatuximab. Isatuximab is similar to Daratumumab, which we just touched base upon, but it targets a different area of the CD38 receptor in the multiple myeloma cell, or a different epitope, as we call. It was a trial. It was a global trial that followed a phase 1 trial that showed it was efficacious and it was safe to administer patients. So this phase 3 trial, they had 2 randomized groups, one with isatuximab, I'm going to call it ISA plus pomalidomide and dexamethasone versus pomalidomide and dexamethasone in patients with relapsed refractory multiple myeloma. Pomalidomide dexamethasone is a doublet that is approved for that setting. So it was a global trial. If the patients were well balanced in terms of the baseline factor, prognostic risk factors of the multiple myeloma and comorbidities. And what it showed is that it's a very efficacious molecule. It had improvement in overall response rates as well as progression-free survival, which was the primary endpoint of the trial. Also, adverse events, treatment-related events were similar. And interestingly enough, it did show in a very positive way that patients who have renal disease secondary to, or kidney disease secondary to multiple myeloma, actually they fare better on the ISA pomalidomide dexamethasone versus pomalidomide dexamethasone in terms of improving the kidney function. And the side effects were very similar. Last but not least, we cannot leave any meeting of malignant hematology with talking about cellular therapy or T-cell related cellular therapy. Although I'm going to touch base really fast on a recent paper that was published in New England Journal of Medicine by Dr. Raji from and a lot of investigators from the US, that is the CAR T-cell therapy against what we call BCMA, that is a B-cell common antigen. It's a molecule that is expressed on all multiple myeloma cells, and it was a very encouraging phase 1 trial. What we saw, and it was updated actually from previous presentation in ASH 2018 by Dr. Max Stopp from Germany and their group, is what we call a BiTE antibody or a bispecific T-cell engager antibody called MGA 420. So what it is an antibody that engages or grabs on one hand T cells through a marker that is called CD3, and it grabs on another hand a marker that is called BCMA from the plasma cell, puts them together, and then engages the T cell, sort of like quote unquote kills the multiple myeloma cells. There was an update of a first in human phase 1 clinical trial of 42 patients that it shows a very promising initial response, and a safety analysis that, with caution, I think in these patients with that have relapsed after multiple lines of therapy, we need to be cautious about it, but I think was tolerable and well managed, the toxicity. Again, this is a phase 1 trial, and we need to move forward to see if to further assess the safety and the efficacy of the molecule, but it is indeed very promising. All of those trials, they're available in multiple sites here in the US and in other sites around the world, and here in South Florida, being Memorial and Moffitt, one of them, for all of our patients and of course for all the community.